Dyslexia Awareness Module, Section 2, Indicators and Screening. Section 2 of the Dyslexia Awareness Module focuses on screening for dyslexia from early childhood through elementary grades. First, indicators of dyslexia across the age range will be discussed. Second, screening for dyslexia will be presented. Finally, we will discuss the significance of culturally and linguistically valid screening for dyslexia and reading difficulties. By completing Section 2 on screening for dyslexia, participants will gain awareness of the indicators of dyslexia. Participants will learn about the definition of screening. Participants will learn about screening tools for dyslexia. Participants will gain awareness of how screening informs evaluation. And finally, participants will learn about cultural and linguistic factors of screening for dyslexia. Part 1, Indicators of Dyslexia. To learn about screening, we need to keep in mind that the simple view of reading, or SVR, views individual differences in reading as a function of decoding and language comprehension skills. Decoding refers to word recognition through both sight word reading and phonic decoding. Language comprehension refers to understanding vocabulary, grammar, and discourse. Each skill is necessary, but not sufficient by itself for reading comprehension. Reading comprehension is understanding what is being read. The simple view of reading does not mean that reading is simple. The SVR accounts for individual differences in students' reading performance. The SVR describes a student's reading at a specific point in time. Importantly, in a student's reading development, the relationship between decoding and language comprehension changes over time. For example, in early grades, decoding accounts for more of the differences between readers. In later grades, language comprehension differentiates readers. The SVR encompasses the full range of readers. Reading comprehension and language comprehension engage the same cognitive capacities but through different points of access, one through print, and one through speech. So these indicators are reflected in screening tools. Dyslexia indicators are different from early childhood to adulthood. The SVR is applicable to reading in alphabetic and non-alphabetic orthographies, such as Chinese, as well as with second language learners. As shared in the previous slide, the simple view of reading, or SVR, provides a clear, effective framework for understanding broad categories of reading difficulties. The SVR posits that reading comprehension is the product of language comprehension and word recognition. The language comprehension component includes background knowledge, vocabulary, syntax, verbal reasoning, and literacy knowledge. The word recognition/decoding component includes phonological awareness, decoding, and sight word recognition. Phonological awareness is understanding how individual language sounds map to print/letters. Decoding is connecting sounds to letter patterns and blending the sounds to pronounce a word. Sight word recognition is the immediate, effortless recall of words that are stored in a person's sight word bank. In thinking about the relationship between indicators of dyslexia and screening tools, we can map the simple view of reading onto individual differences in reading to understand how phonological processing, decoding, word recognition, and language comprehension skills reflect students' diverse instructional needs and challenges. The SVR has significant implications for understanding and addressing students' reading difficulties. It is important to consider that while the SVR represents reading comprehension as a product with each component contributing equally, the relative contributions of language comprehension and decoding vary across the course of reading development at different ages and grades. For example, decoding plays a much larger role in reading among beginning readers as compared to language comprehension due to the fact that decoding presents a much greater cognitive challenge at the initial stage of reading. Also, texts for young children typically do not present complex sentence structures and sophisticated vocabulary. As children become more proficient at decoding and develop a larger sight word vocabulary and lexicon, their language comprehension skills play a primary role in their reading comprehension. This graphic illustrates the broad categories of readers based on the SVR continuum, with language comprehension running vertically as the purple continuum with strengths indicated by the red plus sign and challenges indicated by the red minus sign. Word recognition is on the blue horizontal continuum, with strength indicated by the red plus sign, and challenges indicated by the red minus sign. For example, a student with challenges in phonological processing, word recognition, and decoding, but with strong language comprehension skills may have dyslexia. Their skills would differ specifically from a grade-level peer's strengths in word recognition and decoding. These students could also be compared to a student with mixed reading difficulties, who experiences challenges in phonological awareness, word recognition, decoding, and language comprehension, and who may also have a diagnosis of dyslexia. we also might see students with reading difficulties and do not have dyslexia. For example, a student who has hyperlexia has relative strengths in phonological processing, word recognition and decoding, with challenges with language and reading comprehension. Early indicators of dyslexia for pre-kindergarten and kindergarten-age children may include late talking, slow vocabulary growth, difficulty finding the right word in speech, difficulty remembering lists and directions, mispronouncing words and names, challenges with recalling letter sounds, difficulty learning alphabet letter names, and difficulty with learning and recognizing rhyme. In this activity, engage with the simple view of reading model and early indicators of dyslexia. Please pause the video and complete activity 2-1. Grade 1 students with dyslexia may progress more slowly in reading and writing than typically developing readers, and continue to struggle with phonological processing skills such as rhyming words such as cat, mat, bat, and sat. Grade 1 students may experience phonemic awareness challenges in identifying and manipulating individual speech sounds in spoken words. For example, how many sounds do you hear in the word cat? Students with rapid automatic naming difficulties will have challenges remembering the names of letters and recalling them quickly, and recalling the sounds or phonemes that map to alphabet letters. Grade 1 students with dyslexia may also struggle with recognizing common words by sight or automatically and with word decoding. By grade 1, students may be expressing challenges with language and reading, leading to anxiety and/or avoiding reading and language tasks. Grade 2 through 3 students with dyslexia have difficulties with reading, writing, and spelling, such as identifying sight words automatically and sounding out or decoding words. They may experience challenges with reading fluency due to slow and inaccurate decoding. Reading fluency challenges impact reading comprehension because students are using all of their cognitive energy to decode, and cannot make meaning from the text. Students may experience spelling challenges such as omitting sounds, or using letters incorrectly for sounds, and in misspelling sight words such as said, that, because, and why. In this activity, engage with the simple view of reading model and grade 1 to 3 indicators of dyslexia. Please pause the video and complete activity 2-2. Indicators of dyslexia in students in grades 4 and 5 may include challenges with decoding, comprehension, and spelling. Upper elementary grade students with dyslexia may continue to demonstrate core symptoms of dyslexia even after, or while receiving, appropriate instruction and intervention. For example, oral reading fluency tests require a student to read aloud for 1 minute and test the student's rate and accuracy of their oral reading. A student with slow and inaccurate oral reading, or disfluent reading, is an indication of the underlying issues associated with dyslexia that continue for older students. Other indicators may include a student's continued difficulties with remembering and recalling words and language, comprehension, vocabulary, and spelling. Indicators of dyslexia in adolescent students in grades 6 through 12 include slow reading rate, and increased time and effort needed to complete reading and language-related tasks in comparison to their peers without dyslexia, due to phonological processing and rapid naming challenges. Students may use simple words in their writing that they can spell more easily than words that are more specific and precise. For example, using the word big instead of enormous or gigantic. Many adolescent students experience challenges with note-taking, time management, and organization of verbal information, both oral or spoken, and written, both in the classroom setting, and also in homework completion, due to their reading difficulties and language processing demands. Indicators of dyslexia in adulthood include slower reading rate and accuracy, oral, and written language processing challenges, resulting in increased time and effort needed to complete reading, writing, and language-related tasks. Adults with dyslexia typically benefit from accommodations for reading and writing disfluency, note-taking, and organization due to language processing challenges. It is important to note that each individual with dyslexia is unique. While individuals with dyslexia may share indicators, the severity and duration of their challenges and their responses to evidence-based interventions will vary, based on an individual's unique learning profile. Let's review what we've learned about indicators of dyslexia. Please pause the video and complete assessment 2-1. Part 2, Screening for Dyslexia. There are several purposes for screening. Screening for dyslexia and reading difficulties can be used in different ways. Universal screening can be used to determine a student's risk for reading difficulty and the need for intervention. Screening for intervention planning is when screening is used to make database decisions for instruction informed by results of screening tests. Screening tests can be used for progress monitoring, or to determine if progress is adequate, or if more, or a different, intervention is required. And finally, screening can be used within a diagnostic evaluation to identify an individual's learning strengths and weaknesses, and likely source of academic problems, and to determine if their profile fits the definition of a learning disorder, diagnosis. This dyslexia awareness training module will not go into diagnostic evaluation. In this activity, reflect on your own experience with dyslexia screening tools. Please pause the video and complete activity 2-3. In this overview of dyslexia screening, it is important to keep in mind the following ideas. First, a student's family history should be part of their screening process. Second, there are similarities in measurement constructs and timelines for screening among different screening tools. Third, differences may exist in resources that schools, professionals, and families have for locating screening tools. Finally, there is not one common approach to screening. For instance, there are over 20 different recommended screeners used across different U.S. states, such as Dyble's, Core Phonics Survey, and AimsWeb. Many states have also developed their own screening measures, for example, Arkansas RAN, and PALS Pre-K through 3, from the Virginia Department of Education. The list of OSCE-approved dyslexia screeners is included at the end of Section 2 in the resources. Researchers recommend that dyslexia screenings occur for students before second grade. This recommendation is based on research on the prevention and early intervention research on dyslexia and reading problems. Researchers support the use of screening for dyslexia risk in the early grades for these three reasons. First, early reading problems can be prevented, and problems can be quickly addressed through early identification. Second, students with reading difficulties in preschool and kindergarten continue to struggle unless they receive reading interventions. Lastly, without intensive reading intervention, struggling readers do not catch up to their reading peers. In fact, the opposite occurs: the gap between strong and weak readers increases over time. Researchers have also found that reading interventions that begin with students in third grade and above are less successful and less cost-effective than interventions with students starting in earlier grades. In other words, the later reading interventions begin for a student, the longer they take to work, the longer they need to be implemented with the student, and the less likely they are to be effective. Universal screening for dyslexia in pre-kindergarten and kindergarten is most successful when it includes phonological awareness tasks, for example, phoneme segmentation, blending, onset, and rhyme, rapid automatic naming tasks, for example, letter naming fluency, letter sound correspondence, and phonological memory. In kindergarten, students' knowledge of the alphabet, assessed through letter naming, is a valuable screening tool. Also, early in kindergarten, students developing awareness of the phonemic structure of spoken words is a good predictor of their reading, and is a strong screening measure. Assessing a student's letter knowledge and phonological awareness skills early should be part of a screening system in beginning reading. By the middle and end of kindergarten, students should be screened for challenges with their alphabetic understanding, phonics, as well as their oral language skills. This chart shows an example of an early dyslexia screening tool that assesses areas such as a student's phonological awareness, rapid automatic naming or RAN, sound/symbol correspondence and phonics, and oral language comprehension skills. Phonological awareness assesses the skills on the phonological continuum including rhyming, sound isolation, blending, sequencing, and sound manipulation. Rapid automated naming uses object naming to assess a student's ability to retrieve information in a rapid and automatic manner. Sound-symbol correspondence assesses a student's ability to identify letters by name and match corresponding letter sounds and to apply phonics knowledge to reading of nonwords, MAB, IP. Oral language comprehension assesses a student's vocabulary and word meaning, along with multi-step directions, and sentence comprehension. Dyslexia screening for students in grades 1 and 2 may include tasks in phoneme awareness and segmentation, and also be expanded to include manipulating letter sounds within words. Grade 1 through 2 screening includes repeating nonwords, understanding and using oral and written vocabulary, word recognition, and fluency. In second grade, assessment includes whole word identification, i.e., real words and nonwords, oral reading fluency, or rate and accuracy of oral reading, listening and reading comprehension, and spelling. Grade 1 and 2 students should receive regular assessments of word and/or reading fluency to identify challenges with reading fluency, and for potential problems with reading comprehension. In this activity, apply your knowledge of dyslexia screening across preschool through second grade. Please pause the video and complete activity 2-4. Screeners may vary in terms of administration and scoring. For example, some useful screeners are completed by the student, and other screeners are observational measures that are completed by the teacher. Screeners may be administered to students individually or in groups. Screeners may be computerized or administered using paper and pencil tests. Some examples of reading screening tools include Dynamic Indicators of Basic Literacy Skills, or DIBLS. Ames Web Plus. For the OSCE-approved list of dyslexia screeners, please see the end of Section 2. In terms of effective screening practices for students with dyslexia, researchers recommend a progress monitoring system that assesses student growth multiple times a year. DIBLS and AimsWeb are examples of progress monitoring systems in reading. If there is no progress monitoring system in place, a screening assessment should be administered to all students in kindergarten through grade 3 at least 2 times per year, for example, beginning and end of the school year. The first screening assessment of the school year should be administered as early as possible, for example, within 2 weeks to 1 month of the start of school, so that the information can be acted on right away. Although screening pre-kindergarten and kindergarten-age students may be useful for early identification, it is important to note that early screening assessments may overestimate students with reading difficulties, since students may vary in their preschool literacy and language experiences prior to kindergarten. Therefore, it is important to screen early in the school year, and frequently, with all students. Effective dyslexia screening practices include screeners that are short, efficient, and easy to administer. They should be comprehensive in key domains such as phonological awareness, letter knowledge, rapid automatized naming, vocabulary, listening, and reading comprehension. Family history often offers important clues about reading risk, so family history questionnaires should be part of a dyslexia screener. Screening for dyslexia should be conducted early in preschool and no later than kindergarten. Finally, when selecting a validated screener, it is critical to consider both language and dialect variation. Without responsive and representative screeners, students from diverse backgrounds may be overrepresented in special education broadly, and yet underrepresented in areas of language and reading. Let's recap what we've learned about dyslexia screening. The following are areas that may indicate a student has dyslexia. Inaccurate and/or disfluent word recognition, which stems from the phonological component of language and results in inaccurate or disfluent reading. Phonological processing challenges, processing phonemes, or speech sounds. Unexpected, students with dyslexia may perform at expected or above expected levels on other areas. For example, a student's language comprehension may be a relative strength, and yet, their reading weakness is unexpected in relation to other language skills. Cognitive abilities include memory, visual perception, attention, processing speed, and more. Since dyslexia exists on a continuum, students could experience mild, moderate, or severe challenges across a range of areas. Finally, it is important to remember that dyslexia exists in all languages, and can be diagnosed no matter a student's first language. Let's recap the main points of dyslexia screening for preschool-age students through second graders. Preschool to kindergarten-age students may have difficulty with developmentally appropriate rhyming tasks, difficulty recognizing distinct sounds within spoken words, difficulty producing the speech sounds of the language of instruction, i.e., English, or Spanish and English in a bilingual school. Kindergarten through second grade students may have difficulty with phonemic awareness tasks, i.e., blending speech sounds into words, segmenting words into individual speech sounds. Difficulty recalling all letter names and letter sound correspondences. M makes the sound. Difficulty blending 3 to 4 sounds together while reading. Difficulty reading 3 to 5 letter words. Lack of automaticity while reading. Slow, labored, disfluent reading. Let's review what we've learned about indicators of dyslexia. Please pause the video and complete assessment 2-2. Part 3, Cultural and Linguistic Factors. Here are some important cultural and linguistic factors to keep in mind when screening for dyslexia. Dyslexia screening is often focused on English-dominant systems. When tests are not available in different languages and writing systems, assessing a student for dyslexia may be restricted to English, and could lead to inappropriate and incorrect assessment results. To address this problem of inappropriate and incorrect assessment of students from diverse language learning backgrounds and experiences, screening should reflect students' multilanguage and multidialect learning backgrounds. Being multilingual, or culturally or linguistically diverse, does not increase a student's risk for dyslexia. It is important that dyslexia screenings assess the cognitive processes necessary for reading across languages, such as phonological awareness, vocabulary, and rapid automatized naming, or RAN. Also, screening for dyslexia should account for the different features of specific writing systems that students may know from their home language. This is especially important as there are wide-ranging variations in cultural environments of literacy and reading around the globe. Also, with increasing immigration, multilingualism is now a global phenomenon, and results in students being exposed to multiple languages. For dual language learners, dyslexia screening should be given in students' home languages. Dyslexia measures typically include standards that are based on an English-dominant population. For this reason, it can be difficult to interpret results for English learners or students with linguistically diverse backgrounds. For example, using English-dominant dyslexia screeners may result in a higher than expected classification rate of dyslexia risk status for English learners. Let's review what we've learned about cultural and linguistic factors. Please pause the video and complete assessment 2-3.